Happy Friday, everybody. Dr. Herman here. We don't have a live episode of Nip Talk today. I'm very sad about that. Had some really big surgeries I had to get on. Couldn't find a time this week to get the episode done. But we're going to do some of our favorite episodes from 2024. Leave us a comment and let us know what you think about those. And also, if you have a suggestion for what we should do in our next live episode of Nip Talk coming up next week, please let me know. So thanks, and we will see you next week. Bye. All right, I'm gonna have to ask you guys a question. Have you ever seen ads or anything related to lunchtime liposuction?
No.
No?
I have not.
Oh, you haven't? Okay.
I have not.
So I've seen this pop up a couple times, and maybe it's just because of the things that I follow. It may be, the big brother showing me stuff that showing me stuff that I look up a lot, which is plastic surgery.
Yeah.
So I kept seeing this thing about lunchtime liposuction. And so I was like, what is this? Is this, oh yeah, that's actually a patient that I did. That's liposuction. That's fat.
It looks like really creepy, weird boba tea.
That's pretty gross. Yeah, no, that's actually fat that I sucked out.
Yeah.
That's actually a lot too. I did that like a long time ago. But I remember
It's the straw looking thing.
That's so the suction tubing goes on top of that.
Yeah,
it's not like a straw.
But it looks like a drink.
Oh, it looks like a drink. Yeah. No, that's
Halloween
pretty
drink.
Awful. Halloween drink. All right, so I want to talk about lunchtime liposuction because I've seen some ads about this, and this is my wheelhouse. As I've told you guys before, after plastic surgery, I did a fellowship in cosmetic breast and body surgery. I do tons of liposuction. Love it. Great surgery. So when I started looking into this, I was like, what do they mean by lunchtime liposuction? I quickly found that there's not really a consensus for what lunchtime liposuction means. It really depends on who's throwing it out there.
Sounds like sketch.
It is sketch. I agree with you. And,
okay.
I'm kind of a purist. I hate gimmicky things about plastic surgery, like gimmicky marketing stuff. And I hate stuff that kind of downplays seriousness of surgery. Mm-hmm. And I feel like this is that. So I'm not really a huge fan of this whole idea of lunchtime liposuction, but I want to educate people so they at least know what it is. So when I started looking at these different web pages, as I said, what actually lunchtime liposuction meant depended on what site I was looking at. So I'm going to go through all the different things that they said is considered lunchtime liposuction. But you hear these buzzwords like general anesthesia is unnecessary. There's no incisions, no downtime, fast recovery. You can drive yourself to come get it. And, it was just kind of like, well, that once again sounds kind of gimmicky. Mm-hmm. And we do marketing, but I don't know. I feel that you don't want to trick people into having something. Every procedure is serious business, and you need to go in knowing exactly what it is and not,
Is it like that clip you showed us of that lady who was giving, or somebody who's giving liposuction to people or doing some type of surgery where they're awake?
Wide awake surgery? Yes. Okay, so that is one of them. Yeah, very good.
Ugh.
Yeah, excellent. Okay, so I broke these down into two groups. So after looking at all these different, people who are advertising lunchtime liposuction, it kind of broke down into the non-invasive type treatments and the invasive treatments. Okay. So, and a lot of the places that are talking about the non-invasives are actually those plastic surgery mills that we always talk about, which I am not a huge fan of. So it's
Florida?
kind of, huh?
I said in Florida.
Yeah. Oh yeah, I'm sure lunchtime liposuction is huge in Florida.
Or in Hollywood,
Oh,
California,
big time, yeah. So the non-invasive lunchtime liposuction included things like cryolipolysis. So remember cool sculpting? We talked about that one time. Injection lipolysis, you hear the word Kybella a lot. So that's an injection that goes in and dissolves fat. Radiofrequency lipolysis, which is M-Sculpt, which I've been kicking around the idea of getting an M-Sculpt machine. Of the ones out there like that, I kind of like that one the best. And the other one is laser lipolysis, so smart lipo. Mm-hmm. I think you even mentioned the smart lipo is I think you asked, what is that?
But that's not really somebody sucking.
Right,
fat
exactly.
out of you.
Yeah. It's not really liposuction.
Yeah.
It's a non-invasive fat removing machine of some sort based on those four things. So that's almost like false advertising because, and the reason I say that is I make a very clear distinction between liposuction, which is literally the gold standard for removing fat. It's literally the best way, hands down, to remove fat is to do liposuction, but it's surgery, so you have to take that into account. So claiming that these things are as good as liposuction is a little shady or a little misleading. So the other ones people were actually talking about more invasive things, things where you would make incisions, normal liposuction, but done under local.
Okay.
And that's how they were saying it was lunchtime liposuction. So instead of going to a surgery facility and going under anesthesia and getting liposuction, which is kind of the way I prefer to do these things by far, you go to a doctor's office, they give you some numbing medication, and they do it while you're completely awake, just like that video that we watched. And so, to say that's lunchtime liposuction is not really even accurate, because you're still getting liposuction, so you still have all the recovery of the surgery. Like, you can't go and do that and go back to work. That's insane. So honestly, all these things that say lunchtime liposuction, it's all kind of BS. Like, it's just a gimmick. And so, when it comes to doing liposuction, under local, I've actually done that. I do have the machine and the tools and a room to do it in my office. And I've done it a few times. There are some definite downsides to doing liposuction under local. Number one, you have to do a lot of injections. Because if you're asleep, I can get in there and I can liposuction you really hard, and I don't have to worry about that I'm gonna hurt you because you're asleep and you have all this pain medication. When you're wide awake, it's a completely different story. You have to get perfect local anesthesia in order for someone to tolerate this. And if they're not tolerating it, then it becomes unsafe, because you have a patient that's moving while you're using that metal rod, you can end up injuring them. And so, I was able to do it fine. I was able to, get the numbing in. It's kind of a process, because you have to do a little bit of numbing to then do like a bigger set of numbing. And it takes a fair amount of time. But the issues that I bumped into is that in order to get that perfect anesthetic, where one, you felt like the patient isn't getting tortured, and two, that you feel like it's safe, you are using a lot of numbing medication. And there is a limit to how much numbing medication you can take safely. The numbing medication, as the levels of that start to get higher in your bloodstream, it starts to give some pretty negative effects. The first is like you get a feeling like you're drunk. You get this kind of like lightheaded, and maybe you're acting like you've had a couple drinks. But then as that level starts to get higher from there, it gets actually dangerous, and you can get into arrhythmias of your heart, and if you give too much, you can actually die from it. And I know for a fact that when I've been reviewing bad outcomes in plastic surgery, I know for a fact that some of those are due to people getting surgery in an office setting, and they get a toxic dose of lidocaine or those other anesthetics, and bad things happen. And so, I never had a bad outcome in all the ones I've done. I was very, very selective, meaning if somebody came in and they said, I want a liposuction in my tummy and my flanks, I'm like, no, absolutely not. There's no way we can do that. I would only do it if it was a small area. And I even had one patient that we did it, and we know exactly how much lidocaine we give safely, because you can calculate that based on body weight. It's easy to do. And we had done one side, and I'd used kind of like 3/4 of what I thought was safe. And I actually told her, I was like, look, you needed more pain medication than normal. We're gonna have to have you come back the next day to finish. And of course, she was cool with that, because it's safety and we're doing safe things. But those are the things you bump into when you start to do things in the office. And yeah, you can do it safely, but I don't know. I mean, it's just, for me, it's just so much easier and safer to do it in surgery. And so I'm pretty reluctant these days to do that anymore. I did it for a short time, and
like just watching, like having watched the liposuction, like the process of it. I would not want to be awake.
No, I wouldn't either.
It is so aggressive.
Yes. Yeah. Well, if it's done right, I mean, if you want to do like a half job, I guess you could just do a little bit. But I mean, if someone's paying the money, like, do the job right. And that's where you got to really kind of get after people. And then you can bump into these issues of either their comfort or you're using too much local. So yeah, after doing a little bit of research on lunchtime liposuction, I said, is it glam or is it scam? I think it's a scam. I personally wouldn't let any family member of mine, do that.
Yeah, we like nighttime.
I mean, if you want to go and do like a non-liposuction fat removal, which that wouldn't be liposuction, it'd be like lunchtime treatment.
The stuff
that's
you're talking
one thing.
about.
Because some of those things work fairly well.
Which one works the best, do you think?
I had a cool sculpting
if you wanted
machine.
To do lunchtime.
I had a cool sculpting machine, and I quit using it because, one, I didn't like their business model, but two, we had a fair number of people that would get it done, and they were just like, I don't know if the results are worth it. So, I've been thinking about getting an M-Sculpt Neo machine, which is the radio frequency lipolysis. And that's the one too that also like builds your muscle. Like, you literally, you would love this. So this machine, you can literally get a 6-pack or like big guns just from using this machine. Because
is it like a high tech like TENS unit or
yes,
something?
yes. So it has radio frequency, but it also stimulates your muscles. Like you can slap that thing on, never work out, and like have like a 6-pack and like huge guns. It's crazy. I've actually used it when they came in. They brought one of the machines to my office, and I did a full treatment on my abs. I mean, the thing is like working out. Like you say you're not working out, but you're like, like it's pretty intense. But yeah, I've been thinking about getting one of those machines. I haven't done it yet, just because I have a lot going on. But it's been in the back of my mind. So.
Nice.
So anyway, lunchtime liposuction. Be wary. I mean, be wary of anything that's gimmicky. Anything that's trying to trick you into coming to have a procedure or surgery. Just find somebody that you trust, somebody that's going to go over all the details with you, and just don't be conned into do anything. So.
Yes.
So I'm gonna give lunchtime
I
liposuction thumbs down. So
yeah, we don't like
not
it.
a favor of that. Speaking of need to know, this is a topic that people probably are not going to want to hear about. So in the past month or so, I don't know. Have you seen a lot about the bird flu? You haven't?
No, I haven't heard anything about it at all.
Travis, have you heard about it?
Yeah, I have.
Okay. All right. So I'm not the only one. All right. So in the past month, I've seen a lot of stuff in news articles and social media talking about bird flu. Mm-hmm. And I've heard of bird flu before. I mean, it's not new.
I remember that was popular whenever I was like in middle school.
It's popular. Bird flu's coming back.
Yeah, it was like when George Bush was the president.
Yeah. So yeah, we'll talk about that. So yeah, I kept seeing these articles, and at first I was just like skipping past them because I mean I feel like I still have pandemic fatigue. Like just the thought of like another pandemic coming. I just can't take it. Like the thought of like lockdowns and masking and distancing, like I'm out. And so like when I kept seeing these articles, like no, not again. I can't take another pandemic. But eventually I was like, okay, well, I really have this like belief that like knowledge is power. I was like, okay, I'm gonna like dive into this and see why are people even talking about bird flu right now. Do you guys know anything about bird flu?
No, not really.
I don't know a lot about it. No, I know. I think I had heard that there was some cases. There was a case at least in Texas.
That's true, Travis.
Yeah, right.
Yeah, look at you, man. You're on the ball. All right.
For sure.
All right. Well, I'm gonna get you guys up to speed on bird flu so you can press all your friends tonight at the bars or wherever it is you might be going.
Let's do it.
Okay. So, all right. So unlike COVID, which the very first COVID-19 case was in 2019. That's why it's COVID-19. Bird flu's been around for decades.
Yeah.
They've been documenting cases in humans for over 30 years. But the one big difference between COVID and bird flu, so COVID infected like close to 1 billion people in 4 years. Mm-hmm. Bird flu in over 30 years has infected less than 1,000.
Yeah.
So that's good, right? I mean, if we're talking about like a new virus, it's been around for a long time and it's not really infected a lot of people. So that brings up the question is, why are humans not getting this virus?
Yeah.
So I kind of dug into this. So H5N1 binds to a certain type of receptor that is very, very prevalent in birds and some animals, but it's just not really prevalent in humans. Mm-hmm. It's like the same thing with the COVID that bound to the specific receptor in like the airway tract. The one that's the bird flu binds to, we don't really have. Okay. I mean, some people have it. It can be in there, but in general, we have very low numbers of these receptors. So that's the first thing. The second thing is that the human immune system is very, very protective against the viral replication of bird flu and protective against it spreading from cell to cell. Okay. And so I didn't like go in like so deep a dive to go into the molecular biology of it. Yeah. It just says that our immune system has certain protections against the replication process.
Maybe it's learned.
I don't know. I probably should have looked it up, but like you can get really deep into that stuff, and it's just like okay. Most people they're just like okay, it doesn't. They just want to know.
It doesn't do what it's. Yeah, it's not good at its job.
It's not good at it, right? That's all they want to know. So those two things, the fact that we don't have the receptor specific for it to bind and get into us, and the fact that our immune system actually is pretty good at preventing it from replicating, is a really good reason why in over 30 years there's been less than 1,000 cases. Another big important thing that's good for humans when it comes to bird flu or H5N1 is that it's almost always a dead-end infection. Have you heard that term, dead-end infections?
No.
All right. So a dead-end infection means that it's very, very unlikely that if you get a certain infection, you're going to pass it to somebody.
Okay.
So like the complete opposite of that would be something like measles or COVID, where
so it's not contagious from human to human?
Yes.
Okay.
Yeah. And so there's actually a very specific reason for that. The H5N1 viral particles do not build up in respiratory secretions.
Okay.
That's the big thing with like the common cold and regular influenza and coronavirus. Like the viral particles build up in your saliva, and so when you cough and you sneeze, or even like when I'm talking here, there could potentially be viral particles coming at you. For whatever reason, the H5N1 does not build up in the respiratory secretions, and so that's the biggest reason that in humans it's kind of a dead end infection. Unlike animals that are always kind of touching each other, they're very commonly either eating from the same thing or like having close contact with each other, and that's how they pass it. So it seems that when people do get this infection, they're not getting it from like if you come down with bird flu, you didn't get it from me or you got it from an animal.
Yeah.
And so then that always brings up the next question: is how prevalent is this in the United States? Like is there a lot of bird flu around?
Yeah, who got the virus? Was it like a bird keeper?
So that's a great question. So actually,
Zoo worker?
it was actually a kind of spoiler. We're going to talk about it in a minute, but like it was actually 2 of them were dairy farmers because it's now spread to cows.
Yeah.
So this was kind of surprising when I was looking up bird flu. I was like, oh, bird flu. Maybe some birds have it in the United States. So the CDC says that in wild birds, that bird flu is widespread in all 50 states. Like it's very, very prevalent. In poultry farms, there's sporadic outbreaks in 48 to 50 states.
Oh my goodness.
It's pretty wild. And now there's an ongoing multi-state outbreak in dairy farms. The cows are getting it in 10 different states.
I know birds like to hang out on cows' backs.
Right, exactly. Yeah, that's how the animals are like passing it back and forth to each other. So there's these widespread bird flu in wild birds. There's sporadic outbreaks in poultry farms, and then there's a current multi-state outbreak in dairy farms. This stuff is actually pretty prevalent. It's out there. So the good news
is there a vaccine?
There is a vaccine actually.
For animals?
I don't know if they're giving it to animals. I know that there's a vaccine because I just saw that.
I know there is one because my mom was a nurse, and I remember when it was like that first big like.
Oh, so it's been around a while.
Thing.
I thought it was new because I saw that either the Netherlands or Norway or one of those little.
Wasn't it called? I thought it was called H1N1 back in the day.
There is an H1N1.
That was the first. That was the one my mom was always talking about.
Okay, so this is H5N1.
Yeah.
That's the current one.
Yeah.
I guess, is H1N1 bird flu also?
I thought it was.
Is it? Trellis?
I don't know.
I thought H1N1 was something else. Maybe I'm wrong.
Isn't that swine flu?
Yeah.
Oh, okay.
Yeah.
My mom's. She was always talking about some virus or some type of
Swine flu. Okay.
Okay. Hey, that's another. That one's probably.
Did I tell you guys the story about how swine flu originated in Mexico?
No.
Yeah, so it originated in Mexico, or at least one of the big outbreaks did. So back when my wife and I didn't have any money, during the middle of swine flu, like we took a vacation to Mexico.
You did tell me about whenever you were younger, you went to Mexico,
like
but I don't think you told me why.
Yeah, because it was the middle of the swine flu. Like, there was like 0 people on the plane. Like,
Okay.
It was like empty, and like the resorts were at 5% occupancy. It was awesome. We got the whole trip for like nothing,
Nice.
and we did get swine flu.
Nice. It's
And
always
everyone
good.
thought we were mad. Like our friends just thought we were bonkers.
Yeah.
But anyway, okay, so. Wow, I lost my train of thought. Oh, so the good news. All right, so there's a lot of swine. There's a lot of, not swine. There's a lot of bird flu in the United States. It's in wild birds. It's in like poultry farms. It's starting to get into other animals. Like people were talking about foxes getting it, and of course dairy cows. So with all these animals getting it, there's only been 4 documented cases of humans in the United States, and 2 of them only had conjunctivitis. It didn't even get into the respiratory system.
Yeah.
Yeah.
Was it in their eyes?
Yeah, it was in their eyes. Yeah, they probably got splashed with like raw milk at the dairy farm or something.
Gross.
Yeah, that's pretty gross, right? And so what's interesting is of those 4 people, all of them made a full recovery and none of them had any type of serious symptoms. And so here's the interesting part on bird flu. So when I was looking up the mortality rate for humans, like the stated mortality rate says 50%. Like that's crazy high. I mean, crazy high.
Is it just because like people, they're like, oh, I don't know what you have?
I think you're 100% right. I think that the reason that the mortality rate has stayed to be so high is that the only people getting tested are people that are like really, really, really sick, and they're not sure what's wrong with them.
Yeah.
So probably there's way, way more than 1,000 people that have been infected in the world. And, I think a lot of people, just like these people in the United States who had very mild symptoms, just had very mild symptoms and they never, went and did anything. So I think it probably is actually more prevalent than...
Yeah. And then honestly, if it's people that mainly work with animals, you have to think about, if they take off from work, it's like, that's detrimental to them.
Like they're not taking off work.
Yeah.
They're not going to the
Or
doctor.
they're like, and it sounds like, most people that work with animals are dudes, and dudes don't like going to the doctor.
Right. Well, and also too, a lot of the I looked at like where the deaths occurred. I mean, a lot of it's like third world country as well.
Yeah.
And so
they don't have access to anything.
Yeah, they don't have access to care, and so I think that 50% mortality rate, because I was like, this can't be right. There's no way that this is 50%. I mean, that's like Ebola levels.
Yeah.
That's like insane. Like if there was a pandemic with a 50% mortality rate.
What's the mortality rate for the animal?
That's a great question. I'm not 100% sure. I think it's fairly high in birds, but not in mammals.
Okay.
That's a good question, sir. I didn't actually look at that.
I feel like
I'm going to look that up.
I feel like they vaccinate animals, like farm animals?
Yeah, but do they vaccinate them for bird flu?
I
don't
feel like
think
that's
so.
something they should, if it's like,
I don't know the answer.
if that's where it's coming from.
I'm not sure. Maybe
It's
they
kind
are.
of hard to vaccinate a wild bird, but
Yeah,
a farm,
bird we can't, but
farms with chickens and cows and your horses and all
yeah, that's
those
a good
things.
question. I don't know the answer to that. I will look that up if they're I'll look up what is the mortality rate of bird flu in birds, and I'll look up are animals getting vaccinated for bird flu.
Yeah.
I don't think they are, to be honest.
I
but
mean our dogs. I've never gotten a vaccine for my dogs for it.
for bird flu?
Yeah.
No.
Yeah, I'm saying
it's like,
like
rabies
it's like
and
for
distemper.
farm animals though.
Yeah, I'm not sure. That's a great question. I know a vaccine exists because they were talking about countries buying it. Yeah, good one. I'll have to, and also I'm curious what the mortality rate is in the birds. I mean, there's still birds out there, so obviously like the birds aren't all dying. I mean, I see birds.
We're gonna have zombie birds.
That would be bad. But yeah, I think that high mortality rate that's stated is just due to the fact that they're only counting like the really sick people, like the worst cases, and then it's also third world countries. So how do you avoid bird flu? I mean, this is pretty easy. Don't mess with wild birds. I mean, it's a direct contact thing with humans. It's not like, it's not like secretions or coughs or sneezes. Like you grab the bird and you hold it and then you rub your face. So, avoid wild birds, sick birds, also, farm animals that are sick.
Yeah.
I mean, it should be pretty easy. And also avoiding raw milk, because apparently it can get passed in the milk. It's in the, it viral sheds into the milk. So I guess the final question that, that needs to be answered is, do you need to be worried about bird flu? Like, is this the next thing? No, I mean, in order for bird flu to be a problem for humans, it would have to go through some serious mutations.
Yeah.
Because there's a lot of things that make humans not as susceptible to it. And it is technically possible that it could mutate and that could be a problem, but is it likely that all of those things are going to mutate? No. I mean, I think if it mutated once and then suddenly, okay, well, maybe it still isn't built up in secretions, but now it can enter through another receptor on humans. Okay, it's like, whoa, that thing's changing. We need to be a little bit more, but it still has the thing where it's not easily transmissible because that doesn't build up in the secretions. So, if it mutated one thing, it might be a little bit more, but there's a lot of things about it that make it don't work with humans. Yeah.
Yeah.
So anyway, but it's good to know about it, right? Because now when you see these articles, you're like, oh, okay. All right. Surgery, but I thought it'd be interesting because I don't think we've ever talked about what are the most dangerous surgeries out there, and interestingly enough, I've done a lot of these just because my background before plastics was general and trauma surgery, and so a lot of these actually have some personal experience with. So as we've talked about in the past, overall surgery is very safe. If you look at all surgeries that are being done, so this would include things like I do, such as elective plastic surgery, up to things like heart transplants or even trauma surgeries where people are shot or in bad car wrecks. If you take all surgeries across the board, your overall risk of dying is 0.5%. So that's 1 out of 200. That sounds kind of scary whenever you see that number, but you do have to realize that there are a lot of people who go into surgery with life-threatening emergencies, and realistically they're probably not going to make it through the surgery.
Yeah.
So that does skew it. So some of the factors that affect what the mortality rate for a surgery will be, I mean, there's some obvious things like patient age. Younger people tend to do a little bit better with surgery. Overall health, you know, if you're overall very healthy, in great shape, you're going to have a better chance of coming through than somebody who has, 10 chronic diseases. Whether or not the surgery is elective, emergent, or traumatic, those make a huge difference. I mean, trauma surgeries are going to have some of the highest mortality rates, followed by emergent surgeries, and lastly would be, things like I do that are more elective. Complexity of surgery, obviously, taking off a mole is not going to have as high of a mortality rate as a heart transplant.
Yeah.
And then lastly, overall surgery team skill. So, where you have your surgery does make a difference, whether it's, a level 1 trauma center or, somebody's office does make some amount of difference. So for elective surgeries, because I'm going to leave out trauma surgeries because those are just so random. I mean, it's hard to get an estimate of, what is the risk of dying if you have a gunshot and make surgery. I mean, that's so just esoteric. I mean, a lot of people, basically dead when they come in, but they still go to surgery. So that's hard to evaluate. So I'm going to kind of leave out some of the traumatic surgeries. For elective surgery, though, it is lower. So if you leave out trauma, the risk of surgery goes down to like 0.1 to 0.2%. So I want to go through some of the surgeries that carry the highest risk and kind of start at the top and go down. So the first would be any surgery related to a abdominal aortic aneurysm. So have you guys ever heard of the aorta? Does that ring a bell?
I've heard of it before,
Okay.
yeah.
So the aorta is the major blood vessel that comes out of your heart. So your heart sits here, and there's a vessel called the ascending aorta, and then it kind of goes down, and it has all these branches which supply blood to all your organs and basically keeps you alive. And as we age, the aorta in some people can almost get dilated. I mean, specifically it's called an aneurysm, which is just a doctor word for a unusual dilation. But what happens is just like a tire that gets overinflated, as the aorta gets overinflated or stretched out, the walls get thinner and thinner and thinner and thinner. So as it gets larger, the risk of it rupturing goes up and up. And the problem is this is your main blood vessel. This is it. If this thing ruptures, you are in really, really, really bad shape. In fact, for people who have a rupture, at home, 50% of people die before they make it to the hospital. So after people do make it to the hospital, and then they'll go in for emergent AAA repair, abdominal aortic aneurysm. And I've actually done these surgeries. I worked several shifts doing vascular surgery, and in the trauma hospital I was at, even some of our general surgeons did these. They're very hectic when it comes in and somebody has a ruptured AAA. It's just like they were shot. You have to get them in there and work really fast.
Sounds terrible.
But for those people that make it to surgery, about 40% of those people die. So that would probably be the top, a AAA repair. 40% mortality for an acute rupture. Now, if it's elective, say someone knows they have an aneurysm, but it hasn't ruptured, it's still up to 10% mortality for that, just depending on various factors, because they tend to be older patients, and they are very big surgeries that potentially have a lot of complications. And interestingly enough, there's a famous person that died from a AAA rupture, and that was Albert Einstein, the famous scientist. Yeah, I tried to find somebody noteworthy that had something.
Yeah, he's pretty noteworthy.
I figure Albert Einstein's pretty big. So next on the list would be cranial decompression. So that's kind of a generic term for any surgery where you're taking part of the skull off. And so that can be for various reasons. It could be for a brain infection, could be for trauma. Someone bumps their head. I said I was going to leave off trauma, but there are other reasons why someone would have a cranial decompression. But this surgery basically takes part of the skull off to alleviate pressure inside your brain. Swelling of the brain is a very, very dangerous thing because our cranium, our skull, is not expandable.
Yeah,
and so if the brain starts to swell, it immediately starts to press against your skull, and it can actually kill the brain tissue, which then makes the swelling worse, which then kills more tissue, and it's kind of a cyclical thing that can quickly result in people dying. So when people do get swelling in the brain, a decompression, cranial decompression is the surgery that they would do. I've done sort of these surgeries. I didn't do a lot of neurosurgery, but I did do cranial vault reconstruction for kids with craniosynostosis, which is where the skull doesn't unfuse correctly. or it
Right.
fuses too early, and then they'll have the skulls where it's normal on one side and then
Oh, yeah,
misshapen.
yeah.
And so I worked with a really famous craniofacial surgeon when I was in my plastic surgery training, and we did a lot of those, which is a form of you're doing the surgery for cranial decompression, but without the actual swelling of the brain. And it is dangerous. He's a fantastic surgeon, but I know for a fact that there was at least one patient that died while I was there. I wasn't in on the case because it's just dangerous surgery. I mean, you're
Yeah.
literally taking your skull off your brain, and bleeding can happen, and things can really, get out of hand quickly. But mortality rate for that's 26%. So for people who have to have a cranial decompression, 1 out
It's
of
very
4.
serious.
That's serious stuff. I mean, you don't
Yeah.
want to have your skull taken off. So moving back to the aorta, so the next would be aortic dissection. So this is kind of a more unknown thing. So when you look at the aorta, if you were to cut it, in half and look, on the inside of it, there's different layers of it.
Yeah.
So a dissection is when the blood flow actually doesn't go through the center channel, but it gets in between the separate walls of the aorta itself.
Okay.
And it's almost as though it's finding a different route to push the blood. Well, what happens is when the blood goes in there, the pressure separates the walls, and then it occludes the place where the blood should go.
Yeah.
So these are very, very dangerous things that happen. It immediately causes people to, have all these like very serious symptoms or potentially cardiac arrest. And so the surgery to fix these is a really big deal because you have to get into it normally happen high up, like on the ascending aorta. So you're having to get inside the chest. Mortality rate for that's 22%. So about a little over 1 in 5 patients who go to surgery for that die. John Ritter,
Yes.
who was
Three's Company.
Three's Company. He died of aortic dissection.
Yeah.
I think I scrubbed into one of those cases. I don't have a lot of experience with those. I think maybe I was on cardiothoracic when one came through. I can't remember if it was elective or emergent, but they are pretty big surgeries.
Yeah. That sounds.
Next would be liver transplant. I've actually done a few of these. We had a really big transplant program at the place where I trained. This is probably my least favorite surgery in the world to do. You don't transplant someone's liver because they have a great liver. And so
No.
when you're trying to get the old liver out, it just sucks so bad. Like they're usually really scarred up, very difficult to get out. Then you're having to take a donor liver, put it in, hook everything back up. The longest surgery I ever scrubbed was a liver transplant. It was somewhere around 13 hours for a single surgery, which is brutal. And these do carry a lot of risk. I mean, just the fact that you're taking an organ as complex as the liver out and then putting a new one in and hooking everything back up, there's just a lot of potential.
Yeah, it's huge.
Yeah, I mean, it's you're just saying it in words, it's like, you can really do that? I mean, you can, but it does have some potential problems. And so mortality rate for that's 10%. And, it's an interesting story. One of the very first patients, I did transplant first when I was an intern. And I'll never forget this story. So a guy came in, and he was a surgeon.
Okay.
And he had hepatitis C that he got from a needle stick in surgery. And his liver was failing, and so he needed a liver transplant. And when he came in, he was actually in pretty good shape, because when you're in liver failure, it's not as though you're always on death's door. I mean, it can be controlled to a certain degree. Anyway, so he came in, and we had found a liver for him, so we did his transplant, and then he had what's called an acute rejection. So even though he matched up to the liver donor,
Yeah.
his body just rejected that liver. And so when that happens, you literally have a day or two to find a new liver, or they die.
Right.
So we found another liver for him, miraculously, took him back to surgery, put the new liver in, and then he rejected that one as well. And then he ended up dying, which is, it's one of those things. I mean,
I thought like somebody in my family died of hepatitis C from
really?
They had
Blood
liver
transfusion,
Yeah,
or-
blood transfusion. Like, how do they not? Like, how is that?
Well,
How does that happen?
I mean, so there was a time in the past when they didn't necessarily scan blood for
Yeah.
all these
Well,
various things.
he was like an alcoholic and like had to like have all. He was like his liver was just horrible. 'Cause
So,
he
I mean, if you're an
messed it up.
alcoholic and you have hepatitis C, that's like the double whammy. I mean, that's really,
no,
really bad.
he died as soon,
Yeah.
like very quickly.
Like, liver failure in general is bad, but if you're alcoholic where you have cirrhosis of your liver.
Yes, that's what he was
Yeah.
getting blood transfusions for, I guess.
Oh, okay. Well, he probably could have got from the blood transfusion.
Yeah.
Anyway, so liver transplant, serious stuff. Mickey Mantle died after a liver transplant. He had liver failure, and he did get a transplant. And I think he died like a month later. So Huh?
I said, oh.
Yeah.
Yeah.
I actually met Mickey Mantle a long time ago, back in the 90s. I was a big,
Interesting.
huh?
I said, interesting.
He was a big, I was really into baseball when I was a kid, and he obviously had retired, but he would do these baseball card shows and sign autographs.
That's cool.
And I had a friend who would take me to the baseball card shows, and so I got to meet Mickey Mantle and got his autograph. He was a cool dude. Lung resections. So people that get a lung resection, there's various reasons. Cancer is generally the big one. You know, if you have a tumor, you want to resect that if it's even possible. So lung resection can carry a 5 to 10% mortality rate, which is pretty high. That does depend on how much of the lung you're taking out. Some people will get just a part of their lung taken out, like a small part. Okay. Other people need the entire thing taken out, so that's why there's that.
Can you live with one lung?
You can, yeah.
Oh.
You can, yeah. So anyway, that's another big one. I mean, you're getting inside the chest. If you get infection post-op, I mean, that's very serious. You can get sepsis really fast. So that's another really, really big surgery. Another resection is that, following that one is colon resection, 5% mortality rate. Now, that's a little bit skewing because a lot of people get their colons out and not 1 out of 20 people die from a colon resection. But what this does include is people who've had some sort of perforation of their colon. Mm-hmm. So there's some disease processes where the colon will pop inside of you and it dumps all that stool in your body, and then you get super, super sick, and then they come in and they do a colon resection. Those people are much more likely to die than if you say, you know, you go to colonoscopy and you got a tumor and they got to cut it out. Like, you're probably going to be okay from that, at least from the surgery. Another resection, pancreatic resection. This is an interesting one. This is a procedure called the Whipple. So if you get pancreatic cancer, there's a procedure that takes out the pancreas, part of the small bowel, and part of the stomach, and then hooks everything back up. They call it a Whipple procedure. I did a bunch of those in training because we had a couple guys that were really known for doing them. Mm-hmm. Very tedious surgeries. I really didn't like doing them. In fact, I was talking to my general surgery friends just this week about them, and we both hated doing them when we were there.
Sounds...
Yeah, it's very tedious.
Critical.
And, yeah, just, I don't know.
Detailed.
Yeah. So 3% mortality rate with that. So we're getting lesser, but still 3% mortality rate is pretty high. I mean, that's not insignificant. So next is a straight up heart bypass, CABG. Yeah. They call it coronary artery bypass grafting. You could call them CABGs, CABG for short. 2.5% mortality rate. So that's what, 1 out of 25, I guess? Mm-hmm. Yeah, think about it. So yeah, I mean, for the obvious reasons, when you're working on the heart, there's always the risk of something happening. You know, the graft that you do can go bad. You get an infection.
That happened to my friend's dad. She had...
Really?
Or her dad, like, had gotten an infection, and he was literally getting, like, nurses coming to their house. It was like his chest was open still.
Oh, right. So
and
actually...
they were, like, cleaning it.
But did he do okay?
No, he's fine. He's alive.
Okay, good.
Yeah.
I actually do those surgeries. So that would be a sternal dehiscence after CABG or any sternotomy procedure. So a lot of times plastic surgeons will come in to fix those, and also wound care doctors, which... I'm not really a wound care doctor. I'm just a plastic surgeon that does wound care, but I see a lot of patients with sternal dehiscences after CABG. Unfortunately, it's just one of those things where when you cut open the chest and you sew it back together, it doesn't always heal great.
Yeah, it just wasn't healing.
Yeah.
I just remember, like, whenever we were kids playing at our house, we'd be like, oh, we got to leave because we don't want to see.
Right, yeah.
Because he would literally just, like, sit in the living room, like, sitting on his recliner with this nurse, like, cleaning his stuff.
I have a crazy video of a surgery that I did. I'll bring it next week. It was a patient I got consulted on, and it was a patient whose sternum dehisced, like, so much that you could literally see the heart beating in the bottom of the wound. It was crazy. And so I fixed it. It's a really cool, I'll have to, it's a video, it's maybe like a minute long.
Is it as gross as that other video you showed us? It looked like there was a person inside of.
Yeah, probably so, yeah.
Oh, very nice.
Yeah, you know, I posted that and I really thought that thing would go wild, and I don't know if it's getting throttled or what, but really, I don't know, people were not interested in that.
You posted it, like, on social media?
Oh yeah, absolutely.
When?
This past week.
I didn't see it. It didn't pop up on my feed, so it must not be getting...
Maybe we just posted it to YouTube Short as a test. I thought we posted it to Insta too. I wonder if it's getting throttled because it's like medical. I don't know. I can never understand social media.
Me either.
It's just crazy. Lastly, I put on there just as a what's it called? what's it called when it's not, you don't get an award, but you're honorable mention.
Yeah. Oh, okay,
Honorable
yeah,
mention.
yeah.
I put Brazilian butt lift on there.
Oh,
It's much
we
lower.
hate it.
Huh?
I said we hate it.
I hate Brazilian butt lift. 0.02 to 0.03% mortality rate, which actually for elective plastic surgery is very high.
Yes,
like
we
that's
know
one
this.
in
Yeah.
that's 1 in 3 to 5,000.
And then it goes up if you go to Florida to get it.
Speaking of which, I had two patients this week come to my office that went to Mexico to get tummy tucks and were having back complications.
Yikes.
In fact, the first one came, and then my next office day, my nurse was like, "Okay, we got a patient with, went to tummy tuck, went to Mexico to get a tummy tuck." I was like, "We just saw that patient." She's like, "No, this is another one." I had another one, 2 in a week. Pretty crazy, right?
It's insane.
Wild stuff.
I would
Anyway,
never do that.
let me know what you think about the most dangerous surgeries out there. I did leave out things like gunshots and crazy car wrecks just because those are so hard to kind of quantify. But if you have any questions about those surgeries, please leave me a comment. I'd love to know what you think.